So, Kalimera, and good morning. Thank you so much for this nice invitation. It was very exciting for me to be here, and I'm very honored since I was here last year and participated in the discussion, and now it's the opportunity to bring something that I hope it will be interesting for you. I will take some risks, so let's see. So I kind of invented this word. And the advantage to talk in the end is that all the important things about facts have been said already, so I can take the beauty. So I have this advantage, so I will take it, and I will get it a little bit out of the box. So I invite you to do the same. So first of all, I will thank my team and collaborators that are essential for all my work. I thank in the beginning. So just to show you our fields of work, we have two big areas, genomic and mitochondrial biomedicine, with functional genomic studies and precision medicine based on genetics to tailor risks and treatments and understand individuality and how it will contribute for different risks and different outcomes with treatments. And that's a big challenge. We are included in international consortia for that also, and it has been very interesting. So let's start with the magic recipe to be healthy and avoid risks. So apparently we want to live forever, beautiful, healthy, right? So I have the recipe for that. So it's just, avoid alcohol, be physical active, cut down on salt, sugar, and fat, don't use tobacco products, and eat plenty of vegetables and fruits, and that's it. So where is the problem if we have the recipe, right? So we don't want to live forever, otherwise our species will be extinguished soon, right? But we want to live healthy. Meanwhile, when you live and we want to do something relevant with our lives, that's also why we are here. So we have the recipe. Why? What is missing then? Why do people continue to have risk behaviors that are harmful for their health? Because they can. They can choose. And we cannot just choose like the others wouldn't have a brain to decide. But we have the obligation to literate, to educate, to reduce harm. That's why we are here also. So let's look at the brain functioning and see how the neuroscience can help us a little bit. So let's take an overview to the reward circuitry. So for the reward circuitry, we have different areas in the brain that have to be connected in order for us to feel all the stimulus that make us feel good, happy, have pleasure. So our limbic system in the middle of the brain with substantia nigra, with ventral tegmental area, nucleus accumbens, and the hippocampus, where the memories are managed. And so this system is responsible for our behavior and emotional responses and coordinates impulse, emotions, and memories. But it would be a disaster if we would be happy 24 hours a day. It will be damage your brain seriously. So don't want to be always happy. It's terrible for your health, you know. And if there is someone that creates some difficulties in your life, just be grateful and thankful because they are taking care of your brain health, you know. Because when we have here, hopefully I can use this, here in the limbic system, when he perceives the pleasure stimulus, we get to have dopamine release and all these neurochemicals that are responsible for the good feeling, the well-being sensation. But if it increases too much, dopamine will get you to the other side and you become psychotic. That's why too much happiness is terrible for your health. So what does the brain do to prevent this? Also, dopamine, when it is too high, it will release excess of adrenaline, and it will be damaging for your heart. So pleasure is good, but not too much, you know? But brain has a strategy to avoid this. So when the limbic system is stimulated with all these chemicals released, there is a connection to the prefrontal cortex that will release another chemical, which is GABA. GABA is our brake. It avoids, for example, in my case, to buy too much shoes that I love. You know, I have to process the stimulus, and that's what we do to make our decisions. But to do that, we have to have all these working, and the hippocampus with the memories, with good information that we can use to process all these stimulus. It's marvelous, isn't it? And all these chemicals also regulate the cognitive process, our movements, our learning, our appetite, and our sleep. For example, serotonin is the good mood chemical, but when it is too low, we get a little bit grumpy and, you know, we have some disturbance because of that dysregulation. So it's not just the well-being, it's also other functions that we have to take into account. And also the water is it's very much important to the brain function. If you get dehydrated, you cannot decide properly. So we have to think in all that in order to have the capacity to just make one decision. I go through there or through there. And my decision is better if I know where that door is going to be. And that one also, if there is one there. Okay? So we are all looking for a carrot, right? We need pleasure in order to survive. It's our basis of survival is to have pleasure. And the main stimulators of our reward system is food and sex. The recipe for perpetuating the species. It's very simple. But all the other pleasure stimulus go to the same place. That's why this reward system is key for all this that we are talking about. The problem is that when it's too much stimulated, we may get an addiction. So we have to know about this system a little bit more. So where is my carrot? For me, but a carrot is not always a carrot, is it? It could be many things. For me, a pair of shoes would work perfectly. Not today, sorry, because my luggage was lost when I was coming, and it didn't come yet. So my shoes are still around traveling, but okay. But if I could not control myself in buying nice shoes, it could be disaster for my life and for my family, right? So I have to manage those impulses to buy shoes, or this is a nice example, but you can extrapolate for anything else, of course. So I have changed my focus from shoes to give lectures. I'm a kind of addicted to it. And you know why? Because when I talk, including about harm reduction, with some things that I do that I will show it to you, people make me feel that it's important. So it's valuing, you know, and that's the key for happiness and for well-being, is if someone feels well and valued, there is no necessity to extra stimulate the reward system, you know. So let's see about today. I am taking a big risk in doing all this a little bit different, but why I don't need to smoke. I never smoked. I don't like it. I don't need it. But I have very good friends that I love that smoke. Okay? The important thing is if they know the risks. If they know, they are free to choose. But they should know about it, of course. And, of course, avoid to expose others, especially the most vulnerable. We have to take care of those. So I guess I'm lucky with my genetics, of course, adding life choices and training of my reward system. Reward system guarantees our survival. And besides well-being, it is also related with our response to pain, stress, fear, and danger. That's why we survive better with pleasure in our life, but not too much, Otherwise, you will get psychotic, and nobody wants to have that. And that's why addicted people, especially with alcohol and heavy drugs of abuse, they have psychosis more than everybody else because of the too much stimulation of this system. So our capacity to make decision is located in our prefrontal cortex. That's this development of this area that make us humans besides belonging to the human species. That's this development, because we can do different from our impulses. We can decide different from something that is pushing you through a way that can harm you. So this is a key point. But, we cannot do it just when we are born. This has to be developed during life. An adolescent cannot have their decisions still mature, because this area is only mature more or less at 21 years old in average. Of course, some is before, some is later, some never, but that's another subject, of course. So we need to train our brain to have a break in the impulses sometimes in order to make decisions, right? But we have influencers. Genetics, nutrition, sleep, exercise, social interaction. How? So genetics, we have 2 genomes, will dictate a part of our functioning, namely the efficacy of the reward system. For example, the quantity of dopamine that you can produce is determined by genetic, but also what you eat to produce dopamine will influence, of course. If you have a poor diet in proteins, your reward system won't function because you need amino acids to produce dopamine and serotonin. That's why sometimes these risky behaviors are very much associated with poverty. That's why, because they don't eat protein enough to produce the chemicals that you need for all this to work on in order to feel good. So they will go through another way to get that stimulus, because any substances that gets to addiction is very powerful in stimulate the reward system. That's why. So we have the epigenetics. It's all the environment stimulus that modify or may modify your genetics. We are all different. We do not born all equal, no. It's the opposite. We born all different, and sometimes it's only one letter that can change it at all. Everything, from life to death, passing through many things in the middle, But we do born with the same opportunity to train the brain, especially with knowledge. And the difference between any of us is only 0.5%, 0.4% in terms of genetics. But the environment is much more powerful than that. And concerning the brain is the training that you do during life. I don't have time to do this coffee game, but I know that many people here like coffee, but we don't drink the same quantity because we metabolize it differently according to our genetics and adding to all our habits. So for example, me, I love coffee, but I can drink just a little bit because I'm a slow metabolizer. And this can apply to smoke and any other substance that you put inside your body. So what is amazing for me is to wake up in the morning and open and close my eyes and wow, this is highly unpredictable because we are so complex. This is the simplified scheme of one cell metabolism. Multiply it for 30 trillions with 300 types of cells, different cells in our body that would work differently according to the hours of the day, your age, what you eat, the temperature, the place in the planet. So it's amazing to have a little bit of health. So be grateful each morning. Oh, I forgot to warn you, your brain won't be equal after this lecture, sorry. So adding nutrition, and sometimes with too much fat, too much alcohol, sugar, too much, and smoke and whatever. And I'm, as I said before, very worried about the prenatal exposure because we have to worry in harmful reduction more for those that are vulnerable and that cannot do anything. Even stress. Stress is bad, but there is a chemical reason for that because it alters your brain development if the exposure is in prenatal life. During our life, stress is bad because it increases your cortisol, and higher cortisol depletes your serotonin, so the good mood molecule, and also it increases inflammatory pathways that will damage, like small bombs in your body, especially in your vases. So sleep deprivation is a big problem because you cannot decide properly if you don't sleep properly, you know? It damages it affects the organization and functioning of the reward system, and in adolescence alters the reward system development and maturation. Good things for this is sports, music, social interaction. They are so powerful in stimulating the reward system positively. So numbers of facts just briefly concerning smoking, because I had to also tell you something about this. So the numbers in Portugal, very recent, in this study that was conducted by SCOHRE. SCOHRE is our government organism that manages addictive behaviors and substances, and I collaborate with them frequently. So in each 10 80-year-olds, 50% took tobacco and alcohol before majority of age, and they all selected this main problem related to emotional distress for justifying the consumption. Also, in the last 5 years, consumption of tobacco and alcohol increased, and probably related with pandemic. And in Portugal, we have about 1.7 million smokers in a daily basis, so which is about 14%. And of course, they are trying to reduce, and tomorrow a new project law will be discussed, but I'm a little bit afraid because of the example that we saw in New Zealand that was presented to us yesterday. So I'm a little bit worried. So a cigarette is not just a cigarette. When we have to look at this, we have to look to the whole picture. That's why the Futuromics is in the future, and cost is a great opportunity. So I've registered already, I responded already. It's a great opportunity. We have to register all the habits, all these informations in order to get the big picture and the details about the person, because it's not never, it's just the cigarette. So the mortality in Portugal is here from 2019, but I look at the deaths by car accidents, it's 4 times more. But nobody is going to forbidden to drive a car. So we have to literate, we have to educate, of course. And the deaths by tobacco are the same percentage as the ones by food risks, fat, sugar, salt, and etc. I was amazed, really. So just to stress out, the first experience was never with heated tobacco or so. It was always with the boxed cigarettes. And I was amazed for that. That's why we really have to change to more secure measures. And fortunately, harm reduction is essential, and it's being done. Creating all these more secure measures that are also useful and contributing to smoke cessation. We have conducted this study. I don't have time to go through details about mtDNA, mitochondrial DNA, as a biomarker in lung cancer, and we observed that passive smokers had normal levels in normal tissue. All the others, even in the normal tissue, genetic forms or active smokers had the normal tissue already altered. You know, so research helps to understand mechanisms. So to finish, what can we do? So I'm going just to share briefly to you 2 projects that have been involved about literacy. I go to schools explaining the brain mechanisms related to damage to the brain about drugs and alcohol. So I don't go and say, oh, don't smoke, don't do this. No, it does that. Now you have the power to choose because you have knowledge. That's it. So I really try to save lives through knowledge. It's my ambition. I think it's a little bit too high. So the other project is this one. In my luggage that is going around, I don't know where, I brought 100 books like this. I wrote this book. And it was launched in May. It was a 10-year-old dream to do literacy about mitochondrial disorders. And there is one mitochondrial disorder. The glasses, please, just to finish. You can also try those glasses in the table, the pink ones. There is one mitochondrial disorder that causes those pink glasses. You can put and you can try. It was just an idea that I had to literate. You know, optic hereditary neuropathy, it's a blindness, mitochondrial origin, and when you harbor, even not being a patient, but you carry a certain mtDNA mutation, if you smoke, you can be blind. So I was thinking, how can I teach people this? So I created these classes that mimics the disease because it's completely different. You can imagine, oh, blindness, oh, people don't see. So try it and you will see what you cannot see. And that's a kind of interesting literacy tool. So to finish, we really have to integrate science to harm reduction approaches. No political decision should be taken without scientific knowledge support. And mental health is fragile, like a soap bubble. If we reduce stress, anxiety, increase well-being, we'll be much more successful and in protecting people from harmful effects of smoking, I believe. So laws are not enough. And education and literacy is the key to a better health, of course. And so, Evharisto, thank you so much.